First, we're going to discuss our learning objectives for today. After today's session, we want you to be able to define key terms in adult protective services, understand the various duties of adult services, understand and comply with mandated reporting laws. If you're going to be a social worker, you're a mandated reporter. We want you to be able to identify warning signs of adult maltreatment and be able to connect with resources. If we have enough time today, we're going to go over some case scenarios at the very end, but that's if time is available. So first, we're going to talk about our mission statement. The primary purpose of Adult Protective Services is to investigate reports of adult abuse, neglect, and financial exploitation while providing least restrictive interventions. It is the mission of APS to provide support and services to vulnerable adults in order to improve the safety, well-being, and independence of victims of abuse, neglect, self-neglect, and financial exploitation. So we are governed by several different policies for adult services, and you'll hear me using that term interchangeably. Adult service is kind of an overarching term for all of our programs. We do adult protective services, which is governed by Chapter 9, Article 6 of State Code. But we also serve as substitute decision maker for some folks who lack mental capacity and don't have willing and able individuals to serve as decision makers. So Chapter 44A, the West Virginia Guardianship and Conservatorship Act, governs the guardianship. And Chapter 16, Article 30 is the West Virginia Healthcare Decisions Act, and that's healthcare surrogacy. We're not really going to get into all that today, but I just wanted you to be aware that we do more than just investigate maltreatment. Our programs are adult protective services, preventative adult protective services. We also have homeless services, adult residential services, which consist of adult family care. Those are private homes that provide care for individuals in their own home, well, in the home of the provider, excuse me, unclaimed deceased adult body, and the substitute decision maker policy. So first, let's talk about abuse, neglect, and financial exploitation. What does it look like? What are our warning signs? You know, typical signs of abuse are going to be bruises, cuts, scrapes, frequent falls, maybe neglect, restraints. Imprisonment is in the West Virginia State Code as abuse. And imprisonment could be physical restraints or chemical restraints. And we'll talk more about that as we go through the slideshow. Here's a list of some of the warning signs of adult maltreatment. So when you're practicing with vulnerable adults, there's things that you can look out for when you're working with them. You know, I've already discussed the bruises and cuts and scrapes, but of course, broken bones, your more severe injuries. Also, this one's an important one. Laboratory findings of medication overdose or underutilization of prescribed drugs. Unfortunately, during the opioid epidemic, you know, we see this frequently when working with vulnerable adults. Signs of neglect may include dehydration, malnutrition, untreated bed sores, poor personal hygiene. An elder's report of being neglected. You know, a lot of our reports come from the individual themselves stating that they're being abused, neglected, or financially exploited. Financial exploitation is a little bit more difficult when you're looking for signs of that. These are going to be changes in bank account, changes in advance directives, your living wills. If these things are frequently changed, these could be signs of financial exploitation. And Wade, I'd like for you to discuss this a little bit more.
Yeah, we talk about these different signs of abuse and things like that and maltreatment. One thing that we need to really clarify is with the neglect part or aspect is that you can have self-neglect. An individual who is vulnerable, they can self-neglect themselves. Maybe they're not keeping their doctor's appointments. Maybe their wound care is not the way it should be. Maybe they don't have food in the home. They're malnourished. So we can receive, and we do receive self-neglect referrals on individuals. Somebody can even self-neglect, call in a self-neglect referral themselves, but typically it's probably a provider or a physician or a family member or neighbor or even a church association will call in a referral, and basically it's a self-neglect referral. What we need to understand that anybody, all of us could be neglected or abused. Abuse doesn't just happen to poor people or wealthy people or men or just women. It's no respecter of person or individual. So we must realize that abuse can occur to any gender, any uh, uh, person really. Just our boots on the ground for the reports are the providers, social workers as mandated reporters, physicians, neighbors, associations. We really rely on other people to make the referrals, and I'm sure that we have in the slide centralized intakes, 1-800 number or 24-hour number that you can call in of a neglect or abuse or financial exploitation. In regards to the financial exploitation, that has really ramped up here in the past 5 or 6 years. Typically, I've been with the agency for 20 some years, and typically we would deal with your physical abuse or maybe your neglect, but financial exploitation was not a real big issue for us 15, 20 years ago. But here recently, within financial exploitation, we really have an increase of financial exploitation referrals and substantiation.
Thanks, Wade. So it's important when we're talking about abuse and neglect to talk about the frequency of that. And, part of that is our aging population. So back in 1950, there were 205 million people who were 65 and older. By 2007, that grew by 500 million people. We're up to 705 million, which of course that number continues to increase. In the field, we like to use the term silver tsunami. So, we've got our baby boomers who are starting to age into this older category. It is expected by 2050 that 2 billion people across the world will be 65 and older. 61 million of the total population in the United States is 65 and older. And as far as national statistics of elder abuse, and these are really shocking numbers to us, only 1 in 23 cases are reported. So if these cases aren't reported, then nothing can be done about that. 1 in 10 elders is abused annually. And those who do suffer from abuse are 3 times more likely to die than their counterparts. And they are much more likely to be placed in long-term care facilities. So what happens if you suspect maltreatment of an adult? Oh, excuse me. We do have some more numbers. So in West Virginia, as you can see for a while, the numbers start in 2016. They increased. The referrals were increased until last year. We're not sure why there was a decrease in numbers. There's anecdotal evidence, I guess, but maybe fewer people are calling them in. And we did accept more referrals as the years went on, except for last year.
Hey, Amber, you might want to touch on a fact with this COVID-19 that some may expect that our numbers may decrease, but actually they have remained constant, correct?
Yes, our numbers are the same this year compared to last year as far as referrals received and accepted month by month. So yeah, it was kind of surprising. And other states have reported that they did see a decrease in referrals, but West Virginia has not. So that's good. People are still reporting to us. So talking about reporting, who is expected to report? First, anybody can report to Adult Protective Services. If you have information, if you see something, say something. But the law also has mandated reporters. And in our state code, here's the list of mandated reporters. So we've got, go ahead, Wade.
There's a question I just saw come up in chat. Why would we expect it to decrease due to COVID? Well, with regards to COVID, they kind of restricted people being in the facilities. Just not anybody could go into the nursing home facilities, long-term care facilities. So there were less eyeballs on the patients in those facilities. So there's kind of an expectation that maybe we wouldn't be getting referrals or calls or things like that. Also, there was restriction with our assisted living facilities as well. So that was kind of the expectation, but it turns out that we are maintaining the same numbers, which pleases us, which we're glad to see that our facilities, our facility staff, our physicians are still reporting abuse and neglect and financial exploitation referrals to us.
Yeah, that was a great question. So the mandated reporters consist of medical, dental, mental health professionals, Christian Science practitioners, religious healers, social service workers, law enforcement, humane officers, and any employee of a nursing home or other residential facility. So if we have an employee of a nursing home who suspects that their coworker is neglecting or abusing a resident, that they are to report as well. And the law also has a protection for mandated reporters. Not only are they confidential reporters, but there can be, the facilities can't terminate someone based on a report that they've made. As Wade said, we do have our centralized intake number here, 1-800-352-6513. They take reports 24 hours a day, 7 days a week. You will talk to a live person. If you call, you may have to wait on hold, but you will speak to a live person. We also expect for mandated reporters to send a written report within 48 hours to the local DHHR office. And depending on the type of referral made, additional reports may be made to law enforcement, the medical examiner, the administrator of the facility for a nursing home or long-term care facility, Office of Health Facility Licensure and Certification, and that's always a mouthful for me to say. We call them OFLAC within DHHR, and they do licensing for the facilities. And so if there's a facility-wide issue, OFLAC will go in and investigate. Ombudsman, they look at resident rights, and the Medicaid Fraud Control Unit, because typically in facilities, our residents they're receiving Medicaid to pay for their care there. So Medicaid fraud also investigates those reports.
One question, Amber, they said they have never heard that they had to do a written report as a mandated reporter.
Yes.
Yep.
Yeah, so here is a copy of that written report. This is the mandatory form. It can be found on the DHHR website. And I think there is a, down here, and this is very small. I apologize for how small this is. It has to request additional copies of this form. You can contact the DHHR Materials Management, but you can also go online and download this form as well.
And I want to relate that this is not a new report. This report's been around some time, and this should be trained to your staff. And as social workers, they should know this, especially in long-term care facilities, hospitals, and things like that as well. But I also want to tell you guys that if you're a mandated reporter, when you make a referral, you can ask for the referral number. And they should be able to give you a referral number. It should be at the top of the form there. You can write it down or whatever. But that helps you as well as us as Adult Protective Services when you may call the local district office in each county. Maybe you make a referral to centralized intake, which it encompasses the whole 55 county area of West Virginia. But actually, the referral was investigated in Morgantown. So if you call the Morgantown APS, you have that number. They can type it in our fax system. That's the system that we work at with our computer system to really track and do our investigations. They can bring that up and really be able to access the case and know what you're talking about.
So there are actually a couple of comments in the chat about all this. So I don't know if you're able to see this, but there was a question about whether the written report, if there's any plan for it to become an online submission.
That's a great question.
That has been our long-term goal. We've kind of struggled with that, with technology. And if you know government, we kind of move at a snail pace, so we're kind of slow. But we are moving toward that. There's some legal stuff that we got to work out and things like that, but we have been working on that, and we're hopefully something soon will come out that will be able to do that.
Okay. And then there was another question. It was saying, are you saying that the hotline person has to submit it to the local DHHR office?
No, the process is that, for example, if you are a social worker working in a facility, or you go in working in home and you see abuse and neglect occur, you might be out at Walmart, you might see something occur. You pick up the phone, you call the 1-800 number, you make the referral directly to the live person at centralized intake, and centralized intake is responsible for entering that information and assessing if it meets our criteria or not, to be an investigation. Then they would send it to the local district office for us as an APS worker to investigate that situation.
And to clarify, the mandated reporter is responsible to send the paper form or fax it to the local DHHR office.
Yeah.
So it's kind of like a backup of information. So not only does CI send it to us, but then the reporter does as well.
We don't want things to fall through the cracks, so it kind of is like a check and balance kind of thing.
Right.
Okay, and then there was a conversation about the referral number. There was someone who was saying that they are often told that they cannot or will not provide the referral number. And then someone else said if you request the number at the time of the report, you can give it if they are a mandated reporter.
Yeah. Yes, you have
And
to request that as a mandated. We can't not just give it out to anybody. You have to be a mandated reporter, and you have to request it at the time you make the referral.
and then somebody else said they are often told no anyway.
If you have that issue, contact your local adult services unit, and they can relay that information to us. But as a mandated reporter, that is our stance that
Okay.
we should be able to give that referral number out.
Okay, and then there were a couple other comments about and I don't know, maybe you addressed this and I missed it, but there were a couple other questions about the COVID issue. I'm just trying to scroll back to them. Somebody asked why, let me see if I can find it, why you would expect that the COVID reports, the referral reports would decrease during COVID. So I don't know if you addressed that or not, and I missed
Yeah,
it.
I thought I addressed that. The reasoning, I go back to that. The reasoning was that we thought there would be less people, eyes on individuals that are in placement settings, where they kind of lock down the long-term care facilities and hospitals and things like that. And it turned out that, we still are maintaining the same amount of referrals, which pleases us because we know that adult services, abuse and neglect, and financial exploitation is grossly unreported. So,
Right.
so we are pleased in the fact that we're still receiving the same amount of referrals.
Okay. And then somebody else commented, without getting political, how is it not maltreatment when people died in rest homes because COVID patients were put in the rest homes with them?
Well, I can't.
Well, we'll get into legal definitions as we go. So let's put that question on hold for a moment.
Okay, and I think we're caught up with the chat.
Awesome.
Yeah.
Okay, so what should you expect after you report? Notification of referral acceptance will be sent to you by the centralized intake. We have a standard form that we send out to folks, and it'll just let you know either it was accepted or it was screened out based on APS criteria. And again, we will discuss that criteria as we move forward. Once the adult protective service worker has completed the investigation, you will receive a very similar looking form letting you know that we have completed the investigation, or if we haven't, the reason for that. So, you know that we investigate abuse, neglect, and financial exploitation. Also, code says, or emergency situations for vulnerable adults in the state of West Virginia, which we struggle with what exactly is an emergency situation, and we are not first responders. So if there is a crime going on, please contact law enforcement. They are first responders. We will work closely with them if they request us to do so. So, who do we assist? 18 years of age or older, or an emancipated minor. They must meet the definition of vulnerable or a facility resident in our state. If you're a facility resident, you automatically meet the definition of vulnerable, which we will discuss in depth. And you must be reported to be a victim of abuse, neglect, or financial exploitation. All right, so let's get into the nitty-gritty of our policy and legal definitions. And just to give you a little bit of a background, so this legislative session, Senate Bill 717 was passed, and it made a lot of legal changes for adult protective services. It gave us a bigger definition of who we are and what we do. I'm not going to read it to you, but we receive the reports, we investigate. We also provide case management for those individuals that we found maltreatment has occurred. And the supportive services is a part of that case management. Preventative adult protective services, and a lot of folks don't know that this is an option. So if we're working with a vulnerable adult and there's a threat of harm that exists without intervention, that it is likely that maltreatment will occur, then we can open them for preventative adult protective services.
Amber, I believe it's crucial that we kind of explain the fact that we're not supposed to be long-term. We're supposed to be short-term, no longer than 6 months, get in, get
Yeah.
out, try to resolve the situation, try to maintain safety and well-being for that individual.
Yeah, and in APS, we work with adults who have constitutional rights, and we all have the right to make our own decision. We have the right to make bad decisions. Until there is court involvement that says that someone in the legal definition in the state of West Virginia is incompetent, then you have the right to make those decisions. And a lot of people struggle with that. But, you know, we as social workers understand the right to self-determination. And it's very important when we're doing our investigations for our workers to understand. All right, so these are the new legal definitions for abuse, neglect, financial exploitation. So abuse is now defined as the infliction or threat of physical or psychological harm, including the use of undue influence or imprisonment of any vulnerable adult or facility resident. These definitions are what hinges everything that Adult Protective Services does. So who is a vulnerable adult? Who meets that definition? As I've already talked about, age is someone who, by reason of physical or mental condition, is unable to independently carry on the daily activities of life necessary to sustaining life and reasonable health and protection. You know, legal definitions sometimes can look a little gray, but I feel like when Senate Bill 717 was passed, this section right here, independently carry on the daily activities of life, that really assisted us in determining who was vulnerable. Your ADLs, as we like to call them, can consist of cooking, cleaning, managing your finances, your medications, anything that really has to do with your health and protection. Neglect is the unreasonable, there's a big key word here, failure by a caregiver to provide the care necessary to maintain the safety or health of a vulnerable adult, or self-neglect, as Wade mentioned earlier, by a vulnerable adult. It also includes the use of undue influence by a caregiver to cause self-neglect. And undue influence is a new thing for us. It's especially important when we're looking at financial exploitation. We'll discuss that in a moment. Self-neglect is the inability of the vulnerable adult to meet their basic needs due to the mental or physical condition. I'm not going to read caregiver, but really caregiver can be anyone, whether they've voluntarily taken on the role or they're paid. If you provide care for someone, you are considered a caregiver, which is important when we're looking at neglect specifically. All right, so financial exploitation, intentional misappropriation, misuse, or use of undue influence to cause the misuse of funds or assets. So intentional is a big thing here. Undue influence really has started to come into play in the last several years across the nation. And undue influence can mean a lot of different things to a lot of different people. These can be our sweetheart scams. So, you know, we've got a boyfriend on the internet who is exerting undue influence for someone to send money. But this could also be children who are using their relationships against grandparents or the grandchildren. Undue influence can look like a lot of different things. Our code does not define undue influence, so that can be quite difficult for our workers to prove. Wade, what do you have to say about undue influence?
It's hard to define, but I want to go back to the caretaker example in regards to that. That could just, for example, that could be me checking on my mom once a week, making sure that she has food, heat's on in the wintertime. I could be considered the caretaker of my mother. So it's just not a provider per se, and home provider coming in. It could be a relative, it could be a neighbor that comes over and checks on that individual. They will be considered the caretaker. We also have a question here, Amber. It says, if a report is received about a client living in a deplorable condition, they do not have to let a worker in their home if they don't want to do so, even though the basis of the referral is the deplorable condition.
Right. So everyone has the right to not let someone into their home. And the action that Adult Protective Services would take is to consult with legal counsel to determine if we need to take further steps, which could mean going to the court about the referral to see if we need to get an order to enter into the home, or have law enforcement escort us to the home. It's very dependent upon the situation, the adult who is reported as the alleged victim, and honestly, the judge in the local county has a lot to do with what action Adult Protective Services would take in that circumstance.
A lot of these are not cookie cutter cases. We have to take them case by case. And unfortunately, we have to rely, not unfortunately, but the unfortunate part is that some of our district counties do not work in the same manner, so, but there are some legal things that we could possibly do. We have what we call an order of attachment. If the person is in a deplorable condition, we'll let us in a home, but we can visually see things, and there's certain things within the referral. We've been in conversation with possibly their attending physician. We can go through the legal route through court. We cannot guarantee that the judge will grant us the authority, but that's an avenue that we can follow. We also many times have asked law enforcement to go with us. Typically, when somebody with a badge and a gun knocks on your door, they're going to probably be more responsive than a social worker with just a little badge that says that they're a social worker. So we have those avenues as well.
And as frustrating as that can be for a social worker, just think about how you would feel as that adult and someone showing up to your home. Again, I want to go back to the right to self-determination. So just keep that in the back of your mind when you're frustrated with APS because you call us time and time and again and you feel like nothing's getting done. Just remember that we all do have those constitutional rights.
There's another question too, Amber. What could or would you do about the internet boyfriend if there's a scam?
Yeah, so that's really difficult. And we definitely see an increase in those referrals. It's very dependent, again, as Wade said, everything's very case specific for us. But if we go out and we see that the alleged victim lacks mental capacity to make their decisions, we would work with their physician to possibly get a representative payee put into place, even a conservator, which is appointed by a judge. So it's very dependent. If the physician tells the client and the worker that they have mental capacity to make those decisions, then there may not be anything that Adult Protective Services can do to stop that. We do work with the Attorney General who does investigations for scams. So there are avenues available. Unfortunately, we can't always do things about that.
And also in these financial exploitation cases, we just do our investigation and we kind of turn things over to the prosecuting attorney. They're the ones that litigate it. We do not do that. We just make sure that the person is safe and sound. So that's our responsibility. That's our silo that we work within, and we pass it off to the prosecuting attorney for that county or that district for them to look at, see if they want to prosecute.
Yeah, thanks for adding that, Wade. All right, so Wade talked a little bit ago about our time frames, and as he said that we're short term. When referrals come in, centralized intake determines a response time for face-to-face contact, which we are required to do with the victim. If it's an emergent situation, we look at 0 to 24 hours. Our next time frame up is 72 hours, dependent upon the referral. So if it's not an emergency situation, but it could turn into an emergency situation without immediate response, then we are assigned a 72-hour time frame. All other investigations, we have 14 days to make face-to-face contact, which is shocking for a lot of people, but that's the way our policy reads. We have 30 days to complete an investigation, so that means that we have 30 days to make a decision on whether or not we are going to substantiate allegations of maltreatment. If they are financial,
an understanding too, just because we have these time frames like within 14 days, that doesn't mean that we're going to wait till the 14th. To the 11th hour on the 14th day to go out on the investigation.
Yeah, thank you, Wade, for throwing that in there. So we have 60 days for financial exploitation investigations. The reason for that is because it can be difficult for us to gather the paperwork necessary It could be obtaining bank statements, looking at advanced directive documents. There's a lot more materials that we look at when we're doing a financial exploitation investigation. So if we do substantiate maltreatment, we can open up an adult protective services case. We do not push case management on an individual who has mental capacity. That is up to them whether or not they want to work with us. They have that right to refuse APS services. They do not have the right to refuse an APS investigation. There is a difference between the two. So we are required by law to complete the investigation, but clients can refuse case management services after the investigation is completed.
Amber, there's a statement here that says financial exploitation can also be reported to legal aid of West Virginia Ombudsman Program. Is that correct?
Thank you. Yes, very good. So what is Adult Protective Services Authority? You know, this is really important when we start getting into HIPAA. You know, HIPAA is the big buzzword, and it's difficult to discern who you can share what information with. But our code says that we have the right to a private face-to-face interview with the alleged victim and access to documents in a timely manner, which could mean medical records. As far as it has to be tied to the allegations. We can't go in and request medical records from 5 years ago that has nothing to do with the allegations that are being made. But we do have the right to medical records for investigative purposes. Outside entities are expected to cooperate with and share information to us, and there are entities that we share information with as well, which I've listed those at the beginning, are OFLAX, Medicaid fraud, things like that. And we can provide the mandated reporter with basic information. Very basic information. We can't reveal anything that we've discovered throughout the investigation. When we say basic information, it says, yes, we accepted the investigation. Yes, we did our investigation, and that's pretty much it. Wade, do you want to add anything on that?
I don't think I can add anything to that. I think that's
okay.
Yeah.
So Amber, we have a question in the chat. Somebody wanted to know when the changes for the definition for adult abuse, neglect, exploitation were made to the West Virginia Code, if you happen to know that.
Yeah, it happened just this past legislative session and went into effect June 4th of this year. So this is really new.
Okay, thank you.
Are there any other questions before the next section we're going to get into is case scenarios. So I want to know if anyone has any questions on definitions or just kind of any APS broad questions that they may have. Okay.
No.
All right, we're going to move on to case scenarios, and I'm glad we have some time to discuss these. And if we could maybe, if anybody wants to come off mute and discuss these or put in the chat box what they think about this referral or these referrals, that would be fabulous. This is the time we want some more interaction. So this is an abuse referral, example number 1. When George, 79, lost his wife of 50 years to cancer, his son Lawrence came to live with him. Lawrence was on disability due to a traumatic brain injury. The brain injury caused behavioral changes, including difficulty with self-control and verbal and physical outbursts. The injury also caused violent mood swings. Occasionally, Lawrence went to a neighbor's apartment and got drunk. One night, when Lawrence returned home, George, the father, asked him if he was drunk. Lawrence yelled no and punched his father in the face. So first, we're all on the same page that we would report this, right? Okay. I'd like to know what the thoughts are on the alleged victim, the alleged perpetrator, just kind of a discussion if possible.
So does George meet the definition of being a vulnerable adult? Let me kind of start there.
So there's some comments in the chat. One person wants to see the definition again. One says no, and one says we don't know about George.
Let me see if I can go back. See all slides. So this one.
There are also some other non-case related questions, but we could come back to those when you guys have a break.
All right, we'll do that after this scenario.
Yep.
So
If somebody says Lawrence would be the vulnerable adult.
Very good. That's exactly right. You know, we don't have enough information in this scenario to determine if George is a vulnerable adult. The referral doesn't talk about whether he is independent on his ADLs. Really, the only information that we have about George is that he's 79. In our state, and this is important to note, that age does not make you vulnerable in West Virginia. There are many states that does have a particular age cutoff that says, okay, if you're over 65, you automatically meet the definition of vulnerable. West Virginia is not one of those states. What else do we have on the chat?
No, George, yes, Lawrence. And
Yeah.
I agree, Lawrence.
Yeah. So Lawrence has a traumatic brain injury. So honestly, what would probably happen in this case is that we would go into the home, talk with George and Lawrence both to determine if there was a way to get services to assist them. First, we're probably going to ask George if he wants Lawrence to continue remaining in the home because we've got a violent situation. And because traumatic brain injury, Lawrence possibly could get TBI waiver, traumatic brain injury waiver. So there's a lot going on with this referral.
this will be a good preventative case for us to do.
Yes. Any other discussion on this, or do we want to go ahead and go to the other questions?
Maybe go back to the other questions.
Yeah.
Okay, so let's see if I can find them. So one question was, why are fraud investigators with banks not listed as mandated reporters?
Excellent question. They're not. They're just not mandated reporters. They are permissive reporters. They can report to us. They can share documentation with us. This is also new to the legislation this year. However, banks are still very leery about reporting to us because of the laws that have been in place in past years. But they do have the ability to report to us. Oftentimes, though, we will have to get a subpoena in order to get those bank records if the alleged victim is not willing to give us those bank records.
Thank you. And then the next question is, if a vulnerable adult's caretaker fails to give medications over a period of time, how can it not be substantiated?
I feel like that's a loaded question. I mean, it could be. It could be substantiated. I can't really answer that question without having all the information in front of me, but that is considered neglect.
Right. Okay. And then another question is, what about family members stealing pain medications to use or sell? How would that fit in to APS?
So that's a good question. You know, as we said, we do work closely with law enforcement, and that really is a law enforcement issue. It could be an APS issue depending on the vulnerability of the adult, but also mental capacity. You know, a lot of times when we go into homes, adults are not willing to prosecute their children, regardless of the situation. And this is a barrier that social workers will come up against time and time again. This is the reason why it's important for us to all establish rapport and work on those relationships and talk with the alleged victims to say, hey, this is not right. This is not something that should be happening to you. Right.
Okay, and then we have a couple other questions. What about domestic violence or battery?
Also a legal issue. Anytime we get a domestic violence referral, we do send that to law enforcement.
And then does the definition for adult abuse include if the adult is suspected versus actual seeing or knowledge of it?
To make the referral or to substantiate? I mean, are they wanting to, if it's suspected that it's?
I don't know. So the person who typed that in the chat, can you clarify that? Maybe just type in a message. Just give them a minute to type in.
What I think they're saying is that if they suspect abuse, should you report? And the answer is yes.
Right.
And then it's our job to discern whether or not that's actually occurring.
Right. Okay.
Yeah, when in doubt, always report.
Yes.
It's our duty as DHHR to screen the referrals and see if it needs to be accepted or not. So.
Yep. She said that's her question. So yes.
Awesome.
Okay.
Very good.
And that's it. We're done with the chat for now.
Okay. And as far as reporting, when you do make a report, try to provide as much information as possible. And you'll kind of see this here with George. We have very little information on George. And if you don't know that, that's fine. But anything extra that you can give us to help us to determine whether or not it meets APS criteria, that would be fabulous.
And
especially
also, too, we don't have control over law enforcement. We can make the referral, but it's up to them to go out and investigate, or if it's like domestic violence or whatever, that's their duty. It's not ours.
Yeah, correct. All right, Wade, you want to take this one?
So we have Kofi, 84 years old, was diagnosed with Alzheimer's disease and moved in with his daughter's family. Sometimes Kofi had trouble sleeping and had physical and verbal outbursts. He began wondering, and his daughter and son-in-law were afraid that Kofi might wander out of the house if they left him home alone. They locked the doors to the house so that Kofi could not get out and wander around where they left for work, when they left for work. A neighbor noticed Kofi trying to get out of the house. So what's everyone's thought on this? We have Kofi, 84 years old, and he's diagnosed with Alzheimer's. So I see that we have somebody say, yes, he's a vulnerable adult. So I would agree with that, yes. So what about the perk? Do you believe that you just lock the door and not let somebody out of the house? Is that abuse or neglect?
So we have someone who wants to know if Kofi was locked in when the family wasn't home. And somebody who said, same thing, maybe they need to know if they leave him locked up when they aren't home.
Yeah, it says they locked the doors to the house so that Kofi could not get out and wander around when they left for work.
Right. Somebody says, yes, it's a type of restraint, very unsafe, but would depend on the severity of Alzheimer's. What if there was a fire? Should not be left alone with Alzheimer's. I don't know if I said that.
This would definitely be something that we would screen in.
Mm-hmm.
84-year-old diagnosed with Alzheimer's being locked in, not by their choice, as we read the referral. As we only can go on what we receive. So we can't make up things until we go out and really assess the situation. We may be able to add other allegations when we go out there to the home. We see other allegations. Maybe they don't have food. Maybe they're putting padlocks on the door, things like that. We can add those to the allegations within the referral when we go out to assess the situation. But whatever we receive initially, that's what we have to go with. So, and that's what we accept or we screen out. But yes, somebody should not be locked in a home and not able to escape the home in case of a fire and things like that. So that's something severe. I mean, we have a lot more of these than what people realize, this situation.
Mm-hmm.
Amber, you want to add anything else to that?
I do. I want to note, it does appear that Kofi is probably in the moderate stages because of the wandering, the physical and verbal outburst. So there's probably some confusion if the doors are locked. So that could be imprisonment. However, many people don't realize that locking an adult in the house is imprisonment. And our job, one of the big jobs as social workers, is to educate the families that we work with They also may not be aware that there are resources out there that maybe they can get in-home services for Kofi while they're gone. This may not be a malicious thing. So it's very important that the workers go out, they speak with the family and determine if it's just from lack of knowing that this is not okay to do.
Yeah. And Amber brings up a valid point there, and a very important point is that it might not be malicious, and we go out there and assess the situation, talk to the family. We may be able to verify the allegations, but not substantiate, because it's a serious issue when we substantiate on individuals, because that impacts their employment. Possibly arrests may occur and things like that. So we take this very serious, and we want to make sure we do the right thing with the families and also the alleged victim, what needs to be done. So we take a lot of things into consideration when we go out and do these investigations.
Absolutely. Like Wade said, we try to do what's in the best interest of the client, and it may not be in the best interest of the client to just say, okay, you have abused him, we're taking him out of the home, we're placing him into a facility. I mean, that's probably not the best case scenario, but it is dependent on, what the daughter and the son-in-law are actually doing.
And there's a question that says, would you automatically report to the police in regards to Kofi's situation or any situation? Kofi situation. We wouldn't necessarily report Amber to the police in regards, because it's not really a legal issue.
No, I probably would not report this to law enforcement unless I went into the home and saw some more criminal type. Doubtful that this would be reported to law enforcement. Do you think
Sorry, there were a couple other questions, but go ahead, finish what you were going to say.
I was just going to say, do you think we have time for one more scenario? I know we're kind of getting to the end.
We have about 6 minutes. So,
okay.
Yeah.
Let's go over those questions and then we'll
okay. Just quickly, where was it? Somebody wanted to know if there's adult daycare for people with dementia or Alzheimer's.
In the very large areas in the state, there is, but they are few and far between.
Yeah,
but they have.
Sorry. That is something that's kind of been around probably 5 or so years. That's really kind of ramped up throughout the nation. There's some states that have more than others. West Virginia's kind of been on the slow end of that, trying to provide adult daycare for seniors. One reason is the funding part of it. We don't fund that through Medicaid. Some states fund it through Medicaid.
Okay.
There are programs like the Lighthouse program that they do offer folks. It's like a respite program for the caregivers where someone can come into the home a few hours a day. So there are alternatives available for folks.
And there were a couple notes in the chat about additional resources like special locks that people can get and tracking systems and the Alzheimer's Association, as well as there's a couple other resources. So I know you want to get to the last thing, but just noting that for people if they want to read it.
No, that's great. And I love that you all are sharing resources with one another. That's
but it's a wonderful resource. I would advocate that we have more in the state of West Virginia.
Yeah, absolutely.
All right, real quickly. So we got 4 minutes. So Tamara, 76, lived alone, but had trouble getting around. Her son and his wife asked Tamara to move in with them. Tamara had her own bedroom on the 2nd floor and stayed there most of the time. She could not use the stairs easily. Her son and daughter-in-law both traveled frequently for work and sometimes neglected to give her adequate food and water. They also failed to groom her or to clean her room consistently. One day, Tamara became dizzy, weak, and disoriented, so her daughter took her to the hospital. The hospital staff discovered that she was dehydrated, disheveled, and obviously unwashed. When they asked about her care, Tamara said she was well cared for. First off, we get a lot of this, okay? We get individuals who physically were seeing one thing and then they're telling us something completely opposite of what is actually going on. What are folks saying about this referral?
So neglect, and she knows she should have been on the ground floor, And yes, she should be referred.
And this is one of the situations where we are going to work closely with Tamara's physician to determine level of mental capacity, because it really doesn't get into her mental capacity. It talks more about her physical condition. So, you know, if we work with the physician and Tamara does have mental capacity and she denies that all of these things have occurred, there may be little that APS can do. However, we can always connect with resources, in-home services. We will talk with the family to see what's best for them as a family unit. Any other thoughts?
Not seeing anything.
Okay. Well, fabulous. I know we don't have time to get into the next referral, but I want to say thank you so much for giving us the time to present and talk about adult protective services. We are absolutely a program that is needed, unfortunately, and something that you social workers should consider as you're coming out of school. There's a lot of focus on children, and there are vulnerable adults out there that really need our assistance. It's a good field to get into.
Yeah. And I also would say if you work for a service provider, agency, whatever, if you need maybe a refresher or need somebody to do an in-service for you in regards to adult protective services, contact your local district office there in your local county, and they should be willing and able to provide that for you.
So thank you both for taking the time out of your busy schedules